Prevention and control antimicrobial resistance in Vietnam. So often we hear about this. What is the antimicrobial resistance? We know antibiotics is the drugs used to treat infections caused by bacteria. Antibiotics kill most of the harmful bacteria, as well as good bacteria, protecting the body from infection. Some bacteria survive because of a resistance mechanism. These bacteria multiply and pass on their resistant gene. The new population will be more resistant to the drug and can spread their resistance to other bacteria. Misusing or overusing have made losing the effectiveness of antimicrobial. This is called antimicrobial resistance, AMR, and it is now becoming a global problem. Antibiotic-resistant infection caused an estimated 700,000 deaths each year around the world. According to World Health Organization, by 2050, the number of deaths due to antibiotic resistance could reach 10 million per year. In Vietnam, the World Health Organization has listed Vietnam among countries with the highest antibiotic-resistant infections. Patients are not only resistant with one antibiotic, but also several ones, even the newest, the best and the most expensive antibiotic. According to Vietnam Ministry of Health, while other countries are using the first antibiotic generation, Vietnam has been using the third and even fourth generation of antibiotic. How can microbial resistance spread in Vietnam? In Vietnam, antibiotics are only available on prescription, which is required by Vietnam Ministry of Health. However, Vietnamese people buy antibiotic at the pharmacists without prescription by physician. They have habit of self-medication, self-adjusting dosage. They just go to see a doctor after using antibiotic but still not recovered. Pharmacists selling antibiotic without prescription. The patients just describe the symptoms, and then pharmacists would have self-prescription. According to Vietnam Ministry of Health, in the north of Vietnam, 88% drugstores in urban areas and 91% in rural areas selling antibiotic without prescription. Also the information from Ministry of Health. 76% physician prescribe inappropriate antimicrobial therapy or write down a prescription including antibiotic where there is no truly need. Another wrong habit of Vietnamese that is using their leftover medicine. Every household has a small medicine box. They store the leftover medicine inside there. Whenever any member gets sick, they just reuse the medicine and no need to take medical checkup. Moreover, antimicrobial resistance in Vietnam also comes from improper usage of antibiotic in veterinary and animal husbandry. Currently, there are 10,000 veterinary medicine products are being used, in which 4,637 products containing antibiotic. According to information from Ministry of Vietnam Agriculture and Rural Development, 100% poultry farms and pig farms overuse antibiotic. In Vietnam, antibiotics are used in animal husbandry for the purpose of fattening up pigs and chicken, and prevent the disease. Antibiotic mixed in commercial food from producers. Some products represent the content with more than 10 classes of antibiotic with the maximum dosage. Farmers are easy to buy antibiotic at veterinary drugstores, even antibiotic on the list of restricted usage in animal husbandry. Raw antibiotics are used along with animal food by owners. Farmers buy raw antibiotic at veterinary drugstore and then self-adjusting, self-using for their own animals. And when animals get sick, they also use antibiotic by self-medication without veterinarian therapy. So, what can we do to prevent this situation? For medical staff, only prescribe and dispense antibiotics when patients truly need. Prescribe and dispense the appropriate antibiotic at the correct dose for the right duration. In hospitals and clinics, increase infection control by proper hygiene and sanitation. And at drugstores, patients can buy antibiotic when they have prescription from physician. For veterinary staff, Veterinary staffs need to check seriously the meat products, and only permit products adapt to the regulation about allowed limit of antibiotic. Moreover, new prohibition on using antibiotic in commercial food should be enacted in Vietnam. And one important point is that giving people advice on how to take antibiotic correctly show the dangers of misusing or overuse an antibiotic and antimicrobial resistance problem. And the most important to manage antimicrobial resistance is the intersectional approach of interdisciplinary, human health, animal health, farmer, pharmacist, sociologist, epidemiologist, community, all collaborate and work together to prevent and control antimicrobial resistance. We are breaking all the rules. The antibiotics will lose their impacts. In the near future, there will be some infections cannot be cured by any antibiotics. The time for action is now.